Thank you very much for the invitation. And I'm going to talk briefly about what we're doing in case with patients and investigating the molecular pathophysiology of cardiovascular disease. My name is, as you already heard, Anders Gabrielsen. I'm working at the Department of Cardiology and at the Center for Molecular Medicine at the Solna site of the Karolinska Hospital Institute. So what we have been working with for several years is actually to try and translate the transcriptome in different types of atherothrombotic disease and also ischemic heart disease. So what we're looking at is really stroke and myocardial infarctions as these atherothrombotic diseases which have the greatest impact on public health. And what we have actually investigated is how the RNA levels fluctuates in different types of tissue from these patients. That is the transcriptome, the RNA population that is transcribed from the genome. So as an example, and this is one of the databases that we have, and there are several people in the room that have contributed very extraordinarily to the building of these databases. So I would just go briefly into detail with this. It's called BIKE, the Biobank of Karolinska Endarterectomies, and it's the vascular surgeons at the Department of Vascular Surgery that picks out the plaque from the carotid artery. And this is in a very standardized fashion, isolated in the lab, and we have taken blood samples and a lot of clinical data. What I'm going to talk about today is the molecular analysis that we are actually doing on this, and we are isolating the RNA, and we are doing some gene array studies on this. Actually, we have investigated more than 100 patients in this case, and we have the global RNA gene expression profile from the plaque and correlate this to clinical variables and so on. This is put into a big database, so we can ask a lot of questions. People with diabetes, how does the gene expression look? People with a very severe outcome later on, if they have recurrent strokes or heart attacks, how does it look in terms of RNA expression in these plaques? And this has, of course, this has generated some target molecules that we are interested in. So, as probably many of you know that are here, today there is focusing on visualizing these type of atherosclerotic lesions in different ways. You can, for example, look at macrophage infiltration, or you can use ultrasound, as we just heard, or you can use PET-CT or even MRI. And of course, this is to try to establish before the patient gets sick, or when it just has happened, what kind of patient do we need to treat extraordinarily heavy medications or maybe surgery in order to prevent the disease from occurring or reoccurring. So we want to go a little bit further, and our goal is really to find a partner, a collaborator that can help us look at gene expression in vivo. We have the targets. A lot of the molecules that turns up are actually intracellular molecules, and they cannot be visualized by the ordinary thoughts of having some kind of molecular ligand binding to the cell surface or something like that. We need to visualize in more detail inflammation. Also here we have some gene targets already established. And we need to establish how we can visualize in more detail intercellular oxygen status non-invasively. And of course metabolism. We want to do this in the patient, in vivo, and non-invasively, and that's the goal that we're working for. In that case, we will be able to diagnose the patients early, and we will be able to tell which patients will have a worse outcome later on. Thank you.